To our attention. Thank you. Senator Di Natale.
Thank you, Madam Acting Deputy President. I rise to speak today after recently returning from a Global Fund parliamentary delegation to East Timor. Like many Australians, East Timor occupies a very special place in my heart. I was one of the many thousands of Australians who was appalled at the violence that occurred after the 1999 independence referendum in East Timor, and was immensely relieved when the Australian government finally intervened in that conflict, and felt motivated to help. I flew up to Darwin to visit and help with the processing effort of the East Timorese refugees who were evacuated from Darwin, and I must say that the traumatised faces are something that will be forever seared in my memory. I have many other connections to East Timor. My wife spent some time there. I have many other family members who have spent some time there. And the place of my work in Geelong has a sister city with a small place called Vikeki, a remote district in East Timor, and they have a very active local community there. In fact, I know some of them will be listening this evening. The opportunity to visit East Timor with the Global Fund was one that I was very keen to undertake. I was involved in that delegation with MPs from across the political divide, both here in Australia and also MPs from New Zealand, 8 of us in total. And I think we all got an immense amount of valuable information from the trip. The Global Fund is essentially an international financing institution, and what it does is it tries to pool resources to ensure that we get some serious money tackling issues like HIV, AIDS, tuberculosis and malaria. It's important that with the Global Fund all the money is used in a way that ensures that the countries themselves have ownership of the health programs that are run there, and the funding's performance-based. Since it was started, the Global Fund has become really the main funder of programs to fight AIDS, TB and malaria, and it's directed about almost $23 billion worth of funding to more than 1,000 programs in over 150 countries. So it's been a very successful model. On the first day of the trip, we spent some time just touring some of the important historical sites, and we visited the Santa Cruz Cemetery, which was the site of the Dili massacre in 1991. It was triggered by the murder of a man called Sebastian Gomez. So when we got to the cemetery, we asked a local if he'd take us to the grave. And one of the first things he's struck by at the cemetery is the number of tiny graves. It's a reflection of the fact that this is a very poor country and infant mortality is so high. Well, we got to the grave of Sebastian Gomez, and the fellow who took us there proceeded to start crying when he described the Santa Cruz massacre. As it happened, he was there, and he lifted up his pants and revealed a large bullet wound in his thigh. He started telling us about how the Indonesian military was there waiting for them, ambushed them, shot people indiscriminately. He told us about how the 2 American journalists and English filmmaker were also there. Max Stahl, the English filmmaker, he helped him hide the film that was taken of the massacre, and how after the massacre they went back to find it to try and document what had happened. It really was a reminder of how raw some of those experiences are for many of the people who live in that country. Over the course of the week, we met with some of the most inspiring people that I've met with, both people who were local East Timorese, but also some of the expats who are working across a range of areas. So we visited people and clinics where treatment was being provided for multi-resistant tuberculosis, and for the first time people were getting access to life-saving treatment. We went on a number of visits, some to some reasonably remote outposts where we saw the distribution of bed nets. A really simple measure, a few dollars, but the distribution of bed nets means that pregnant women, young kids are now not getting malaria, and we're talking about an environment where some of the strains of malaria that result in cerebral malaria mean that young kids die from what is a preventable and treatable disease. We learnt that there were a number of people who were providing really important education about the spread of HIV, what could be done to prevent it, distributing condoms and fighting stigma and discrimination. One of the real concerns for me is that we have the potential for a major HIV epidemic on our doorstep, and we need to be, I think, directing as many resources as we can to that country to ensure that we try and minimise the potential for a very serious HIV epidemic on our doorstep. One of the most important things about the work that was being done through these projects is that they weren't standalone projects, but they were really building the capacity of the local health system. And it's important to know, or to acknowledge, that they're starting from a very low base. And so to have the funding available to train people to look down microscopes and identify tuberculosis, to have people who are trained in entomology so that they can assess whether there are programs to try and reduce the spread of the vectors that cause malaria. All of those things that are a vital part of a functioning health system were all being done, and that was one of the legacies that once these programs are finished will be left behind in that country. We met with people within the health ministry and learned about the important work that's being done to develop the health capacity within the bureaucracy. We met with the Australian and New Zealand ambassadors and the head of the AusAid mission, learnt a lot more about what's being done from an Australian perspective with our aid dollar and the focus on health, governance and a range of areas. Australia being a very, very critical player in the effort that's going on in East Timor. We were very fortunate to meet with a number of MPs who were all very generous with their time. And this is a country that is essentially building their democracy from the ground up. They were thirsty for knowledge, desperate for anything that we could provide them that might provide them with the opportunity to perhaps create some of the building blocks for their fledgling democracy. The welcome we got was overwhelming at times, incredibly warm, and we were very privileged to have been given the honour of being welcomed in to people's homes and their workplaces. We were also lucky enough to spend an hour with the new president of East Timor, Taud Matan Ruak. He's a very inspiring figure, a man who spent decades in the resistance movement, essentially fighting in the struggle for a free and independent East Timor. He acknowledges the huge challenges that his country faces, but one of the terrific things about what the country is doing is one of their most important assets are their oil and gas reserves. With some help from the Norwegian government, they've set up a sovereign wealth fund. They've ensured that the money can't be spent all at once. In fact, only 3% can be spent in any 1 year. And so they're using that as a sustainable revenue stream so that they can build all the important infrastructure that's necessary for their democracy to function, the roads, the water and sanitation, the health and education systems that are so vital. One of the take-home messages from me from that visit was just how critical our aid dollar is and how international financing mechanisms like the Global Fund, but also the domestic effort through AusAid, just how critical that is. And of course trade's important, and international trade within our region's important in helping to alleviate poverty, but without that direct aid dollar, these people will not get access to TB treatment, life-saving TB treatment. They won't get access to bed nets. They won't get access to the important information they need to stop the transmission of HIV. So it was an inspiring trip in many ways, because the problem in East Timor is not one of corruption, it's one of capacity, and what's being done through the Global Fund is ensuring that the capacity is built. It's a funding mechanism that ensures that the programs that are implemented are owned by countries, and I think it's a really terrific model to ensure that our newest democracy helps to build a sustainable health system and, in fact, a sustainable democracy.
Thank you, Senator Di Natale. It's important for us to hear those delegation reports and to understand the importance of our AusAid investment in those countries. Thank you.